This skill is inserting a nasogastric tube. It can be found on page 494 through 496 of your Fundamentals Handbook. The first thing you want to do is make sure that you check your doctor's orders and gather all your necessary supplies. You'll need an NG tube, cup, water, syringe, tape, and an emesis basin. Once you have all your supplies, you'll go in and speak with your patient about the procedure, making sure that they understand everything. You're going to want to perform some hand hygiene. And then get ready to position your patient. During this video, this is a run-through of how an NG tube should be inserted. As always, refer back to your book and read it and understand the procedure and the rationale behind each step. When you're talking to your patient, you want to assess which nostril they can breathe out of easiest, as this will be the placement nostril. So we've determined that the left side would be the most appropriate. You want to make sure that your patient has an emesis basin and a towel available. And you want to make sure that you have raised the head of the bed to 30 to 90 degrees and about waist level, or whichever is comfortable for you at a working position. From here, you'll want to don your gloves. And you'll want to check your packaging. Again, you'll check your packaging for any rips, tears, making sure to look for the expiration date. Once you've done so, you can open your package and you should find inside an NG tube. This is not a sterile procedure, but you do want to maintain as much sterility as you can to avoid contaminating your patient. Once you have the tube, you're going to measure from the tip of the nose to the tip of the ear and down to the xiphoid process. Once you've determined the correct position, you'll want to mark the end of that tube with a piece of tape. As this tells you where to stop when you're inserting the tube. You want to lubricate the end of the tube. And then begin insertion. Again, you want to make sure that when you insert, if you meet resistance, you immediately pull it back out, as you can damage tissue. Once you've inserted a little bit, you want to make sure that you tell the patient to start taking small sips of water and lean their head forward to assist with making sure that the tube goes down the esophagus. Again, you'll slowly inserting the tube to the level of where the tape is. Once this has been done, you're going to want to check for placement. In checking for placement, you'll need a syringe, and you'll pull up about 10 to 20 mLs of air, and you'll place that into the end of the tube. Using your stethoscope, you'll place that over the top part of the stomach, and you're listening for a swooshing sound or bubbles. Once you've heard that, you know you should have correct placement, and then you're also going to want to aspirate for any stomach content to have a double verification. You always put back whatever you have aspirated, unless the doctor orders differently. Once you know that you have good placement, you can secure the tube to the patient's nose. You'll want to clean it with alcohol first, and then place This helps in the tape being able to stick well. And you'll take and secure the tube. You want to make sure you secure this tube well. They also have new nasogastric tube holders that are in use, but if not, tape works well. You want to make sure that you put it on.
Teaching you like this, or to the cheek.
And position it to the cheek. And once it has been positioned and taped down to the cheek, this gives it more stability. And then per your doctor's orders, you may connect it to suction or you may leave it just clamped. Remember, this is uncomfortable for the patient. Offer any comfort measures that you can and make sure that you check on the patient frequently.